Hi everyone, this is a special review for your upcoming exam AP1 Exam 2 and the Exam 2 is from Chapter 5, 6 and 8 in the 10th edition of your textbook. Two things to emphasize. There's no PowerPoint associated with this review, so you would see a blank screen. And also, you have to know that you should not limit your studies only to this review, nor to the PowerPoint that I presented. You need to read the chapters as well. Going over, this is a very short review, of course. I'm trying to emphasize the very important facts. So that's why I said, like, this is not not all about all the questions, but I felt like this would be help if I do this. This might helpful for your exam too. The chapter 5, it describes about the skin. Chapter 6, it describes about the skeletal system, its development, different types of bones. And then chapter 8, it describes vastly about the joints. With related to the skin, first we discuss, with related to the chapter 5, it actually talks about the integumentary system. So integumentary system, you should realize that it's not only the skin, but its appendages, such as the hair, nails, sweats, and the sebaceous glands. So we discussed that in the lecture. With related to the skin, we discussed about the epidermis, dermis. So those are the two components of the skin. So therefore, you need to know what cell layers which makes the epidermis and the function of those cell layers. For instance, like the water loss is one of the functions of the epidermis, and the keratinocytes, which secretes the glycolipids, would help to prevent this water loss in the epidermis. And withholding the mechanical stress. So that is one of the function of the epidermis as well. And the spinosome layer in this epidermis, with the help of the desmosomes it has, would help with related to withstand this mechanical stress, like that. And also you need to know function of the dermis, what components make the dermis. Of course, you need to remember that it's highly vascular. Epidermis is avascular. It gets its component from the diffusion of nutrients, but the dermis is highly vascular and it does have lots of sensory receptors. So with related to the sensory receptors, since we encounter the word, you have to know the different types of sensory receptors, their function, which receptors for your touch, which receptors your pain, like that. Yes, so also with related to the skin colors we talked about, you have to know like which condition, which physiological conditions or the disease conditions which gives rise to skin color. So those are the important ones, which I thought that would be helpful for the exam. And with related to the appendages, we talked about the eccrine glands, apocrine glands. So you have to know, like, if you're given an example to categorize into eccrine or apocrine, then you need to know. And with related to, especially would I want you to read around the hair growth. It would encounter in page 159 and 160. You will see that the hair growth is in 3 phases: the active phase, the regressive phase, and the resting phase. So read around that. You might see questions from that as well. Yes, and then you need to remember the hypodermis is not part of the skin, but it's underlying the component of the skin. So you have to know like the functions of those, especially what components that it's composed of. You would see that adipose tissue and its functions. So please read your textbooks and refer the PowerPoints. With related to the bones, chapter 6, we talked about the development of bones, and also um, we talked about the structural unit, the osteon, and you have to know its structure and its components, and what does the central canal do, or what does it consist of, and how the cells there, what type of cells they are, osteoblast, osteoclast, like that. And also we talked about the compact bones, the spongy bones. You have to know where these bones you would find in your skeletal system and their special features. Also, we talked about the ossification of bones, the primary ossification, secondary ossification. You have to know where it's going to be arised. For instance, like primary ossification happens whether it's in the diaphysis or in the metaphysis, the metaphyseal growth plate, conditions related to it. Please refer to those. Also, generally the function of the skeletal system, what does it do? And also the hematopoiesis, like the blood cell formation, where it happens in the bones, and in adults, if you have to take any samples because it's clinically relevant, what kind of bones that you can use. So that's how, like, we learned, like, okay, these are the bone marrow that it's there, and we you might see in the lecture that at different ages you have to pick different locations, so that is, you have to look those things as well. And also functional and structural classification of the joints with related to the chapter 8. Yes, so with related to chapter 8, it's all about lots of joints, and then later the disease conditions. Yeah. So with related to the joints, you need to identify, like, if a bone is given, or if a joint is given, then whether it's the plane of the movement, whether it's uniaxial, biaxial, multiaxial, like that, and also the classification of joints, like how you classify, what features you need to classify for functional, what features you consider to classify it structurally, and then like fibrous joints, cartilaginous joints, synovial joints, and further you can classify the fibrous joints again, and also cartilaginous joints. So you have to remember with the example. The challenge with AP1 exam always goes with the remembering part, and also the physiological part is where you need the critical thinking, like what you know into apply into questions. And so with related to the joints, mainly you have to remember a lot of examples to answer the questions. Also, so with related to the joints, if a joint is given, for instance, we'll say hip joint, you have to know, like, whether it's a synovial joint, and whether it's axial would be, whether it's uniaxial, multiaxial, and with category that it belongs to, like that. With related to the chapter 5, I would special emphasize on the Wolff's law. You would see questions from that as well. With related to the joints, back again, there's half of the chapter is devoted to the synovial joints, which means, like, it's very important, and you would need to know the special features of the synovial joints, the examples, such as, like, what joints comes under pivot joints, saddle joints, and also the associated components of those synovial joints, such as the bursae, tendon sheaths, and what is the function of bursae, what is the function of tendon sheaths, like that. and also the different types of movements that you can perform, like abduction, adduction, circumduction. Sometimes the questions not directly come as like, what are the functions of the synovial joints? No, it's not like that. It's sometimes given it as like, for instance, shoulder joint is part of the synovial joint. So the question might come, the functions, the movements that can be performed by the shoulder joint. So in that case, you have to first identify what is the type of joint is the shoulder joint. So you have to identify this is a synovial joint. And then you have to think, okay, the shoulder joint is abduction, adduction, circumduction, all those performance can done with this shoulder joint. Like that, that's how you try to critically think with related to the questions. And I would special emphasize on the shoulder joint, knee joint, and the hip joint. So look at those special features in there, as well as its characteristics and what does they do, like especially the knee joints. If you remember the meniscus, the intercruciate ligaments, what are those functions, like that. Also, with related to the disease conditions associated with the skeletal system, you would have encountered the osteoporosis. So that's a common condition. So therefore, you have to know a little bit of around it, the conditions leading to osteoporosis, the risk factors, the treatments, and also, of course, skeletal system is associated with the level of the blood calcium level. So factors which would leads to elevation or lowering blood calcium levels. What will happen if you inject vitamin D, the hormone calcitonin, like that. You have to think critically of what you have learned. So as I mentioned before, this is not all in your exam too. This is just a quick, brief review, which I thought that it would be helpful for you all just to get an idea. You would see the sample questions that I have posted, so you can get an idea. It has been there for a long time, even at the beginning of the semester. So if you have take measures, you can get an idea of what the exam to look like as well. So thank you. I'll see you at the lecture.